Good morning, dear students. Today we will proceed with our study of anatomy part 5 that will cover a little bit about the bones. Bones is such a structure and you will handle the bones with your own hand. Almost every one of you will have your bone sets. So sometimes you will feel yourself to be tantric-like also. As because this is the first year MBBS. So you will have one of the bone sets into your possession of a human being, unilateral or bilateral, and each of the bone you have to read in details. But before that, little bit about the general anatomy of the bones you must have to keep in mind. So this is a priming class for your study to start with bones. But before starting on to the study of the bones in proper, let's revise our previous study where we have covered the specialized connective tissue under the gross heading of sclerous tissue. That is one part is cartilage and the second part today is the bone. So in the cartilage, we have known what is cartilage, the components that is forming the cartilage, classification of the cartilage, different types, hyaline cartilage, white fibrocartilage, and neuroelastic cartilage, and the distribution of the cartilage in the human body. So must remember and read meticulously. Also prepare your own notes as in the form of short notes of each individual cartilages. Try practicing the histological diagram of all the cartilages. So also prepare the distribution of the individual cartilages for your MCQs. So these are the probable questions you will face in your exams. Now in the present presentation, we will cover the bone as a sclerous tissue, functions of the bones, gross structures, periosteum, that is the covering of the bone, and classification of bone. Bone is a big chapter, so we will divide it into 2 or 3 sub lectures because each of the lecture, if exceeded more than half an hour, it becomes a little bit of heavy to take on. Okay, so I will divide in 2 to 3 short lectures. So these lecture now, bones as a sclerous tissue. It is a specialized, relatively rigid. Scleras is an Greek origin. The term means hard. So it is definitely a rigid tissue. It is rigid than the cartilage too. If the consistency of the cartilage, we will say firm, the consistency of the bone is hard. And it is constantly changing. See, the bones in your childhood or infancy are very small in size. So also their configuration do changes with increase in the size as we grow up to adults. So this is constantly changing connective tissue. Even then, following different sorts of fractured stress modulation, the bone changes its architecture. It is composed of cells known as osteoblast, osteocytes, and osteoclast, along with the intercellular substances. Intercellular substances are the substances which are surrounding the bone cells. And here, in case of bone, the intercellular substances is a must that it is impregnated with calcium phosphate or calcium salts to make the bone rigid. In opposition to the architectural and the characteristic of the cartilage, which is avascular and non-nervous, but bone is vascular, it also having some nervous connection. Coming to our presentation, we will now follow the functions of the bones. Remember, wherever the bone is lying, it is serving its basic function of forming the skeleton along with, so it's basically form the rigid framework of the body that is known as the skeleton. Details has been said to you. Bones act as the levers for the muscles. This will get more clear when we will talk about the muscle actions and joint movements. It affords protection for the viscera. Think about the skull giving protection to the brain. Think about the thoracic cage giving protection to the lung and the heart. It contains bone marrow. Bone marrow is such a tissue loaded with fat and hematopoietic component, which gives rise to all sort of blood cell line. And bones, as it is mineralized, having the calcium phosphate salt, so it takes active participation with the help of vitamin D in the maintenance of calcium metabolism. As huge amount of calcium phosphates lies in the bone, in its intercellular substance. So in time of need, the calcium phosphate storehouse is the bone. Now in the gross structure of the bones, the outer side of the bone having a layer of compact bone. Compact means very thick. Though it is thick, but it is porous. And inner part having spongy bone. Spongy means it's not soft. It is having sponge-like appearance. Within the bone, several bone, very thin plates of bone are distributed in different directions. And when they cut one another, give the appearance sponge-like. So from there, the name is the spongy bone. Compact part is ivory-like, extremely porous, and the spongy part that is lying inside is known as the cancellous bone. They are composed of trabeculae, and trabeculae are formed at the site of or line of internal stress. Each bone is covered by a membrane-like structure. It is known as the periosteum, and it is absent at the end of the bone when the bone is taking part in formation of the joint. That is known as the articular surface. But here is an exception point. Must remember, sesamoid bone having no periosteum. Interior of the adult long bone contain medullary cavity filled with bone marrow that is lined by vascular endosteum. So if you will say of the bone lining is two. One is periosteum on the outer side and one is endosteum for the long bones having the marrow cavity. See, this is a picture. This is a schematic diagram of the cut section of the longest bone of your body. That is the femur. This is the upper end. This is the lower end, and the shaft has been cut open. You can see thick bone onto the outer lining. Here, the thick bone onto the outer lining. It is ivory-like, so this is compact bone. And inside, you can see several lamella are going in different directions. They are cutting one another and giving the appearance of the sponge. So these are the spongy bones. And inside the shaft part of the long bone, it is empty and it is loaded with the bone marrow, the red bone marrow or the yellow bone marrow, depending on the age, which are responsible for generation of the hematopoietic cells. This is another picture of the same thing. You can see this is the vessel running inside the cortical bone or the compact bone. And from there, it traverses to the spongy bone. This is the endosteum, and this is the periosteum outside. Thereafter, the compact bone. Thereafter, the spongy bone. Then the endosteum. And this is the marrow cavity loaded with the bone marrow. The periosteum is such a structure which is very, very vascular. Now, to say about the periosteum is two-layered. One is outer fibrous layer, which is very tensile and giving protection to the inner layer. And it is the layer as it is lying on the outer side, it is giving attachment to the muscles, their tendons. And the inner layer, that is inner to the outer fibrous layer, is cellular, one layer of flat cells. And it is very vascular. Must remember it is osteogenic layer, because they deposit bone on the outer surface of the bone. You have learned this in the growth of the cartilage. The same way bone also grows in girth via the appositional method. Okay, via deposition of the osteogenic layers cell lying on the inner layer of the periosteum to increase the bone in girth. So functions of the periosteum are, first of all, it is giving protection to the bone. As it is lying on the outer side, it is giving protection to the bone. It receives attachment of the muscles. It maintains the shape of the bone. Nutrition to the outer part of the compact bones are by periosteal vessels. and subperiosteal deposits of bone for increasing the width or the girth of the bone. In the last presentation, we have said about the classification of the skeleton as per distribution, and we have named them. We have known the name of the 206 bones lying in an adult skeleton. Now, the skeleton is formed of bones, and the bones are classified in several ways. One of which has already been said to you is the axial skeleton, that is highlighted in this blue, the skeleton lying along the axis of the body, and you know the names. These are the appendicular skeleton, highlighted in again blue, lying onto the extremities. Now, as for ossification, this is another separate point. The ossification will be taught to you in details in next presentation. So as per ossification, how the bone is developing? Via ossification within a cartilaginous model or via ossification on a membranous structure, or both way. So that divides the bone into bones having membranous ossification, such as the flat bones, parietal, scapular blades, etc. Cartilaginous, mainly the long bones, and membranocartilaginous bone, which are partly flat and partly having substances, such as one bone is known as the sphenoid, lying at the base of the skull. How does the bone look like? As per shape of the bones, it is classified several ways. First is long bone. Clearly, any of the bone or any of the structure in your body will have minimum 3 dimension, length, breadth, and width, of which the greatest dimension is the length. So those bones are said to be the long bones, such as femur, humerus, the bones mainly lying onto the limbs. Then the short bone or the small bones, having 6 surfaces, almost cuboidal in shape, and lying in the region of the carpus or tarsus. That is the carpal bones or the tarsal bones. Flat bones, the bones looks itself like plates, such as skull bones, scapular blade. Irregular bone. Irregular means not matching particularly to any of this classification. Neither long, neither short, nor flat. Okay. Rather, it is a combination of all of this, such as vertebra, hip bone, like that. Pneumatic bone are those bones, pneuma meaning to air. So pneumatic bone are those bones having air containing cavity inside it. Those bones lying surrounding the nasal cavity, such as maxilla frontal. Sesamoid bone are seed-like bone. They are mainly formed within tendon. They are patella, pisiform, and so on. Accessory bone are the additional bone other than all these bones. Now, this is a very important theory question. And definitely, when you are going to face the bones, what type of long bone, why we are saying them to be the long bones, you have to get it very clear in your mind. So, first starting with the long bones. Long bones are those bones whose greatest dimension is length. It has 2 ends. You see, this is the femur. One of the end is lying above, so this is the superior end or the upper end. One of the end is lying below, that is the inferior end or the lower end. It is distributed mostly along the length of the extremities and distributed vertically. All the references are said in comparison or in references to the anatomical position. Remember, what is the anatomical position? And in that position, how the bones are lying. These bones are actively take part in bearing the body weight or transmission of the body weight, and so also the force. They are mostly cartilaginous in ossification. The basic model from which it develops is cartilaginous, and it is mainly the handed cartilage. At least 2 epiphyses at the 2 end. What is epiphysis? What is diaphysis? These are the parts of the long bone we will see in next lecture. And it has 3 types. One is typical, modified, and miniature. Typical, this term will come repeated time. That means it maintains all the features said to be a long bone. It has at least 2 epiphyses, 1 diaphysis, and all the other features of being cartilaginous in ossification, taking part in transmission of body weight and their distribution pattern. Okay, so these are the bones of the extremities lying onto the arm, forearm, thigh, leg. Then coming to some long bones which follows some of the features, but because of the region they are lying, doing the functions they need to do, they are modified some way. Okay, how it is modified will be explained to individual bones in relationship to individual bones. So these are called the modified long bone. Such modified long bones are, one is clavicle. This is clavicle lying onto the upper part of your chest. This is the clavicle. See, in comparison to a typical long bone like humerus, it is distributed horizontally. It is not cartilaginous in ossification, but its greatest dimension is length, and it takes part in transmission of force or transmission of weight of the upper extremity to the central skeleton. So this is a long bone, but a modified long bone. Same way, if you see a structure known as the vertebra, so the body of the vertebra, this part is the body of the vertebrae. Body of the vertebra takes part in transmission of your body weight. So the body of the vertebra is also a modified long bone. Some bones, see here, these are the metatarsals. So also the metacarpals here. Okay, these bones here also the greatest dimension of the bones are length. So they are long bones, but they do not follow the other criteria, such as they do not have two epiphyses. Every one of them has one epiphysis. For the metacarpals and metatarsals, they are present at the head end, except the first one, where it is present near the base. But for the phalanges, both in case of the fingers and the toes, they are present at the base. They are present at the base. And because of this first metacarpal or metatarsal is said to be the modified phalanx. Then coming on to the short bones lying in the region of your foot, these are the tarsal bones. So also in the region of the carpus or the wrist, these are the carpal bones. 8 for the carpals, 7 for the tarsals. See, these bones are individually very small, cuboid looking. So when we are saying of cuboid or cube, it has 6 surfaces, of which the adjacent surface, that is almost 4 surfaces in every bone, except those lying at the end. 4 surfaces are articular, articulating with the surrounding. Only the 2 surfaces, that is facing the dorsal and the ventral aspect, they are free for the attachment of the muscles, ligaments, tendons, etc. And every one of them having a single epiphysis near at its center or somewhere, having a single epiphysis. So it is basically a small models or small collection of hyaline cartilage inside which ossification center appear and it ossifies. So its basic structure is like that of epiphysis of any long bones. And structurally they are same like that. All the tarsals and the carpals do start their ossification after birth, but only 3 bones, that is the calcaneum, this bigger one forming your heel, this is the talus, and this is the cuboid bone. These 3 tarsal bones do start their ossification even prior to the baby's birth. This is an exception to remember. Also can come as your multiple choice question. Now coming to the flat bones. The flat bones looks like plates and they are flat in appearance. They are membranous in ossification. 2 plates, one outer, one inner. And these two plates are made up of compact bone with intervening spongy bone. And these spongy bones are known as diploid, having some marrow inside, such as skull bones and the scapular blade. These are the skull bone, scapular blade, sternum, even the ribs. All these are the examples of flat bones. Now, irregular. As I have said that all the previous criteria of being a long bone, short bone, small bone, or any other sort of flat bone is not met via these bones, that is the vertebra. So they are irregular in architecture, not matching any particular type. So these are the irregular bones, such as the bones forming the base of the skull, vertebra, hip bone, like that. Pneumatic bone. Now to say about the pneumatic bone, pneuma meaning to, pneuma or pneumo is a Greek origin word meaning to lung, breath, hollow, air. So it is air containing structure. In dry bone, you will see the cavities. In living, the cavities are lined with mucous membrane to convert them into a structure known as sinuses. They are mostly lying surrounding the nasal cavity because this is the cavity through which air goes in and comes out. So during the process of inspiration and expiration, when air goes in and comes out, all these paranasal sinuses. Para means by the side of. So these two are the frontal sinuses lying inside the frontal bone. These are the two maxillary sinuses, each lying within the body of the maxilla on the either side. Then you have series of multiple number of ethmoidal sinuses divided in different groups, anterior, middle, and posterior. All these takes active participation of different functions to make the skull lighter because no solid bone is there. Those areas is like puchkas, okay, having air inside. So makes the skull lighter, helps in nasal intonation, and also helps in air conditioning of the respiratory air. So as these are the potential sites, any infection of the surrounding area or one area may spread onto the other areas. So also these are seen from the front side. This is another one lying inside the body of the sphenoid is the sphenoidal sinus. All these are the pneumatic bones having the pneumatic cavity. This is a very nice bone, sesamoid bone. Their numbers are also variable, depend on the one person's occupation because they are produced inside the tendon and the tendon at the site where the muscle are inserted onto the bone attached to the periosteum. So these are the site of friction. And at the friction site, small collection of first bones can appear. And these are small seed-like bone. These are small seed-like bone. And from the word means sesame, coming from the Greek or Arabic origin, meaning to the seed. And as these bones are formed within the tendon, so definitely they are developing after. Act as the pulley for the muscle action because they are formed inside the tendon and their number are variable. Some of the examples are given. In almost everyone present, the biggest sesamoid bone is in front of your knee, is formed within this tendon known as the quadriceps femoris. Why this quadriceps? Why femoris? Everything I will explain. So it will be stuck in your brain. You will never forget. Okay, gradually. So this is the patella, or as it is capping the knee from the front, it is also known as the kneecap. There are some other examples of the sesamoid bones I will come to, but before that, get the features of the sesamoid because sesamoid bone is very nice bone and very catchy question of choice for the exam. So almost invariably a question or a short note you can get regarding this bone. how it is separate from the other bones, you know. It is devoid of periosteum and Haversian system. It is developing after birth within the tendon of the muscles. Some of the examples is patella, pisiform. It is developing within the tendon of the flexor carpi ulnaris. Meaning, action of everything. This is said by the name that I will explain. Then flabella, lateral head of gastrocnemius, where it is lying. It will just gradually get clear, but get the name right now in your brain. We will clear it gradually. Rider's bone in the adductor longus tendon or tendinous origin. This is the patella. Thereafter, this is the pisiform. These are the two sesamoid bones. Now, accessory. Accessory means anything more than the exact count. So, they are not regularly present and not of uniform number in every individual. Must remember. And at the beginning of the study, we have said that the number of the bones in adult skeleton is 206 is a variable term because of their contribution or their number increased via the accessory bones. So also the sesamoid bones also, depending on the lifestyle. So this is a picture of the skull seen from the back. These are the suture lines where the two bones meet. This is the sagittal suture formed between the two parietal bone. See, this suture should be straight in this way, serrated appearance. Okay, but within the suture there is another bone. This is another bone. Very small bones of individual ossification center. So these are very small, worm-looking, worm-like. So they are known as wormian bone. And how many of them will be present in one individuals? No one knows. Depending on the presence of the accessory bones, the count goes on increasing. So also see here, between the two parietal, there should be articulation of the occipital bone from back. But the upper part of the occipital bone may not fuse with the rest of the part. And it lies as an additional bone between the two parietal bones in the posterior part. So they are said to be the interparietal. This is not a common feature in every individual, but it may be present in some individuals. And this goes on increasing the count. This bone is present between the two parietal. So this is interparietal. See some of the wormian bones. This is an interparietal bone. This is a rough calculation of the total number of bone of 206 inside your body. Long bones are total 90, short bones are 28, flat bones are 36, sesamoid bones are 4, named sesam, that is 2 pisiform and 2 patella only coming in count. The extra are not coming in calculation. Okay, some irregular bones. Okay, that is 48 in total count. Go on matching the number with your study till you have done in count of your 206 bones. This is a very important and interesting math for you. And also it will do revision of the consequent topic in your mind. So about the presentation, this current presentation, you have to revise in your mind different types of bone, the basic architecture of the bone, the classification of the bone under which mainly the long bone, short bone, modified long bone, miniature long bone, sesamoid bone, irregular bone, pneumatic bone. Any of them can come as short note and also as a MCQ question, specifically the sesamoid bone, the names of the sesamoid bone and where it lies. It's very catchy to the exam. In the next presentation of Study Anatomy Part 6, we will cover the parts of a growing long bone, how the bone grows and its ossification. Okay, in details. So that much for today's study. Please revise. Without revision, repeated recapitulation, nothing will be in your mind. Anatomy is itself is a volatile subject, but very interesting subject. If you can create the interest in your mind, anatomy is in your grip. Good luck, students. Happy learning. Bye.